Hi. So I did my pre and post conference for CNAs in a hospital setting who were doing the necessary clinicals to be able to get their CNA level 2 license. That's a license in Oregon that is required for CNAs to be able to work in the acute care setting or in the hospital setting. Basically gives them some more mandatory education and allows them to get checked off to do skills that are more pertinent to the hospital settings. I had 4 CNAs that were going through their clinical on their very first day. They all get spread out into 4 different floors with different preceptors. And they aren't the floors that they're going to be eventually working on. They're just floors that are have a lot of the skills that need to be checked off on to give them that experience. And then they actually would, for each of the 4 days that they're going to be doing clinical, they rotate to different floors and they rotate through different preceptors. But this was their very first one. So they were going to be very skill and task oriented, of course, with beginners, novice to expert. They were in the novice level and really focused on the tasks. And so for them, especially since this was just their first day, I really just wanted them to be able to take the time and the freedom that they had to observe a little bit and be able to observe what their preceptor just kind of their overall time management and organization, and to look at the communication between the staff members. This pulls a little bit from Carl Rogers' learning theory, the experiential learning theory. So this is one where I really wanted to have them, be able to initiate their own learning on the floor to help facilitate that. And I wanted them to start looking at things that would be useful and meaningful for them in their own practices. So be able to kind of watch their preceptors' time management strategies and utilize the things that they thought were really beneficial and to bring that into their own practice. I also pulled a little from social learning theory, where students not only are looking at the performances, but they're also looking at the interaction between the nurses and the patients and the CNAs and kind of seeing the overall picture of that. So to do their pre-conference, I went ahead and made a Prezi presentation and just to kind of help guide the process. So I'm going to go ahead and get that set up here. So we all just were sitting together in a very informal setting, just kind of sitting in a round table. And so the first thing we just wanted to talk about were the different objectives of the day. First one is the professionalism. So I wanted them to employ professionalism through their appearance and actions as defined in Salem Hospital Policy. This was something that they were prepped for ahead of time, especially with the appearance part of it. So they were all wearing the appropriate scrubs and had their hair pulled back. But we also talked about their actions as well, now that they're in a professional role in a hospital and what that means to them. And sorry, then the second objective here is for to demonstrate safe, competent CNA level 1 clinical practices under supervision of their preceptor. So these are the things that they're already checked off on and they already have the licensure for. They don't need a clinical instructor to be present for, but to also just get practice in doing that in a real life setting. Next one is for their CNA 2 skills, to perform CNA level 2 skills accurately and efficiently in presence of the clinical instructor. Time management. So this is this part where I want them to observe and to get ideas for their own practice. So I want them to critique time management strategies observed with their preceptor and other staff. And the last one is communication. So compare and contrast positive and negative communication techniques noticed between nurses, staff, and CNAs. All right. Then we went to the skills checkoff, which they all very much were thinking about the most. We just went through a reminder of the level 2 skills, and they also had a little card that they could put in their pocket to carry around to remember which ones they need to get done. The things that we talked about, remember these are people, not mannequins. Be respectful, provide good communication, explain what you're doing. We said ask around to see if these skills are available on any of the patients on the floor. So even if it's not just in your patients that you're caring for with your preceptor, to look around for those skills. And luckily this hospital and my hospital does these CNA2 checkoffs a lot. So everyone's pretty aware of when these CNA2s are out on the floor, the CNA2 students, what their needs are. Text or call an instructor about 5 minutes before you're ready to do the skill. And then the last one is just a reminder, and this is part of that professionalism, which is to go off stage to use your phone, if you will, meaning that on stage is actually in front of the patient in their room. Off stage is to go out in the hall before using your phone. I really wanted to talk to you about how they're feeling if this is their first day out on the floors, and wanted to see if they had nerves or if they were excited or anxious, or just, generally how they were feeling. It sparked a pretty good discussion. Most of them had worked as CNAs before, but not in a hospital or done any acute care or anything like that. So it was new. And one of them in particular mentioned a lot of concerns about communicating with her preceptor and feeling like she would just be thrown into things, and that's not her learning style. And then we talked about how they're absolutely able to discuss with their preceptor what their needs are and what their learning style is, and maybe even come up with a game plan for a day. Maybe they would be just observing more for the first half of the shift, and then maybe be a little bit more hands-on the second half once they felt more comfortable, and that's okay to have that discussion. So goals for the day, and this again is a lot on Carl Rogers' theory, but it's showing up with an attitude to learn. Something can be learned from everyone, and learn what you want to take into your own practice. We talked about observing, taking that time to observe and look for some of the bigger picture concepts. And then the last piece is that I actually had discussion topics that were written out on index cards that went with them. These are things that I want them all to think about, but just for timeliness, and also because they had a lot of other things going on, I asked them just to take one of these topics and really focus on it so that they could bring their experiences and their knowledge back and share it with the other CNA2s. So real quick, how did you view the nurse and CNA relationship? This one talks about describing a time when your preceptor had multiple tasks and how did they prioritize those. This one talks about how does your preceptor organize their daily cares? How did they keep track of their patients and the tasks that needed to be performed? Do you think that was effective? And then what is one skill or technique you learned that you plan to use in your practice, and name more than one if you can. And so that final piece, we just had to go through a few of the tasky things they needed to remember. We talked about, finding their way, getting settled, finding the break room, locker room, getting connected with their preceptor. This talks about just making sure they take the breaks that are needed and trying to take breaks when their preceptor does. In this last piece, we talked about preceptor communication. So feeling like they can openly talk to the preceptor about what they're comfortable with, what their learning style is, and a reminder to let them know what skills they need to check off that day. So then we ended up doing the post-conference. Basically, my role throughout actually the clinical day was just to round with the other clinical instructors, and we would check the students off on the skills, check in with them, make sure everything was going okay, make sure their experience with their preceptor was going all right. One initial complication we had is that one of the preceptors got floated to a different floor, so we had to find a different preceptor to set one of the CNA students up with. We went to the manager and just asked for a good recommendation of the CNAs on the floor who would be a good teacher for these students, or good someone to shadow. That worked out smoothly. We were able to find actually a recent CNA level 2 graduate who was able to train one of these CNA2 students. So it comes full circle. It was good. and be able to help them troubleshoot some things, which was I hope a good learning experience for them. You know, one of the students, one of the skills is to be able to place telemetry leads, and so she had gotten everything placed perfectly, but for some reason the box was just not working and turning on appropriately. And so just simple things like troubleshooting, oh hey, the batteries are dead, but you know, kind of going through that process. Another one that was interesting is that another of the skills is to remove a saline lock. And so for this student, the saline lock, the extremity that it was charted on was actually the wrong one. So the extremity was the left extremity that she actually removed the saline lock from, but in the charting system it said it was a right saline lock. And so we had to decide what is the best way to appropriately chart, because you don't want to discontinue the site that's not truly the one that she discontinued. So we talked with her nurse actually for that patient. She was able to get the charting remedied for the right extremity, and then the CNA was able to chart appropriately on that. And so in post-conference, I had those two students in particular talk about those two experiences that they went through, with their permission, of course, because I thought it was interesting that the rest of the CNA 2 students would be able to learn from as well. So post-conference, again, super informal, and we just got in a round table where everyone could see each other, and started off with that basic question: how did it go? How did you feel? How are you doing? Did it meet your expectations? Was it different, or was it the same than what we had talked about in the morning? We talked about the skills in particular, so that psychomotor domain, but the skills were a big part of what the CNAs were working on today. And so they were able to share with each other the stuff that they were able to check off on and share their feelings about doing some of the skills for the first time. One of the students actually had a patient who was deceased, and that's the saline lock that she removed. And so she was able to share kind of some emotions related to that as well, and we were able to talk about just in general what it's like to have a postmortem patient and the cares that are involved with that. So for the affective category, the objective that I had was to employ professionalism in appearance and actions. You know, the appearance one I think is relatively easy to do, but to actually have the right attitude towards it and the right attitude towards the actions is something that I'm not sure can immediately be developed, but I was hopeful that the students would start understanding the big picture and the importance of doing that for patients. And so what we did is kind of played a game of, you know, what if you were the patient, and what kind of a CNA would you want walking into your room, and how would you like them to act towards you? And so we were able to do that discussion and talk about the importance of professionalism. And then one of the students was able to share an experience that she had with her nurse, and it was actually a poor experience where she felt like the nurse was not maybe as kind, and said that she felt like the nurse was rushing the patient too much. And so we were able to talk about how that is something that hopefully they won't bring into their own practice. And if that was a patient that they were caring for and they saw their nurse kind of being like that, well, maybe they could try to spend a little bit of extra time with that patient that day to help give them a better experience if they could. The cognitive, so that was a lot of where we were talking about the organization and the prioritization. They talked about all of the CNAs were able to share some of the different organizational tools. One of them talked about how their preceptor would list things down the side of each of her patients' lists, such as bath and oral care, and just to make linens change, to make sure that those tasks were done on every patient every day, and that they like to do all of those main tasks at the beginning of the day, so it would save time for the chaos that can happen towards the ends of the shift, where discharges and admits are usually happening. So that was something that all the CNAs were able to learn from a little bit. Overall, I feel like it went really well. It was a really good group of students, and they seemed to have a really good attitude of learning. They seemed to come out of it feeling pretty good, and they all expressed that they were feeling okay going into their next day of clinicals with not a lot of concerns. Again, it's still very task focused, but I feel hopeful that they were able to start seeing some of the bigger picture ideas of what the CNA role is in a hospital setting.